I personally feel that patients are the final safety net in the whole process of care. I think they're the people that can stop bad things happening, and that's a really vital point of call, and I think we don't give patients enough credit to be able to act in that role, really.
It's very interesting when we talk about patients having a vested interest in their care and looking at safety. We don't teach people that actually their health is their business.
As a patient, I really want to be involved. I have a vested interest in the care that I receive. So I want to be involved in that whole process, and I want to be able to feel empowered to challenge when things are wrong. And that's really, really important to me.
We are desperate for the patient health record so that the patient can actually continue with their self-care management, and that is a huge safety issue.
So I presented myself to the day case unit to have this surgery done. I'd never met the surgeon who was going to do it. I double checked with the surgeon that he knew that I had metal stents rather than plastic ones. He wasn't aware of that fact. I would have put myself under an unnecessary anaesthetic because he wasn't able to perform that procedure. So it's really important that you recognise that patients can do this double checking. We know everything about our health, and we can stop harm coming to us by safety netting as a last point of call in a process of care. So I find it incredibly difficult to speak up when I see poor practice. And I think that's because you don't want to jeopardise the relationship with the healthcare staff that are looking after you.
Historically, patients have actually been given information. They haven't had information shared. So it hasn't been a partnership. It's actually been an incredibly patrician system, and sadly the system continues to be patrician in some areas.
It's a bit of a power struggle, isn't it? That you've got the clinical staff who often act in quite a paternalistic manner, and I'd like to think that I'm an expert in what's going on with my health. I'm really well researched about, the type of cancer I've got, and I know when something's going wrong with me. And that power struggle is difficult to resolve sometimes. I was really poorly right at the beginning of my illness. I was developing renal impairment in hospital, and it was really difficult to get the clinical staff to listen to me and to hear what I was saying about what needed to happen with my own health. It was just a really hard struggle, and wading through treacle almost, feeling of frustration that they just didn't want to listen to me, and I think they thought it was just being a difficult patient, but I was trying to avoid harm happening to me. Patients should be at the heart of the safety agenda because they're the ones on the receiving end of care. They are the experts in their condition. They understand a lot more than we give them credit for about what happens in hospitals and in healthcare in general.
In terms of looking at the system and how it works, from the bedside view, you actually see things that busy staff don't see. And I think that patients need to be equal partners in terms of helping to deliver that training and educating other patients and clinicians in that journey. And they also have a great view of how the ward and the staff interrelate to each other, and they can pick out all the safety issues that actually individual members of staff wouldn't focus on.
I had a temperature after an operation which was not quite at the limit where it would have triggered a medical review. But that temperature for me was really significant because I'm chronically immunosuppressed from my chemotherapy. But the nurse didn't want to listen to that. She was just following the protocol. She wasn't listening to what I had to say about my condition and seeing me as that condition in person rather than a protocol.
When the ambulance actually took me to the hospital when I was really ill, it took me to A&E instead of an internal ward that I was supposed to be going to. But the A&E staff insisted that I go through the A&E system when all of my information from a GP was actually sitting on the ward waiting for me. There was at least a 24-hour delay between me being where I should have been, and that's an unacceptable patient safety breach to me. And then coming out of the hospital, the nurse who actually wrote up my notes had never seen me before. She didn't come to speak to me. She clearly hadn't looked at all of the notes because the wrong diagnosis was actually written down on the letter to my GP.
There is a tendency that we don't think about the end receiver, that we think about the processes and we think about how we're going to do something, but we don't actually think about why we're doing it or who we're doing it for. And I think that's probably why patients have been sort of on the sidelines as patient safety as a concept has grown. But I think that's wrong, and I think patients now need to kind of jump into the centre of it. I didn't see the true value of patient involvement until I became a patient. And I think that's because healthcare professionals just generally don't want to be challenged. They don't want to have their practice criticised, and they don't want to see the patient as an expert because they see themselves as the expert. And that
perspective, the main focus needs to be on training staff, and then as staff are trained, they're trained to expect patients to be empowered rather than passive. And actually they could get some brilliant dialogue going and support each other in terms of raising quality and safety standards. In terms of patient safety, there should be a culture where patients are actually recruited as volunteers to be able to be involved in the safety agenda. Patients are looking from the point at which they enter the grounds of a hospital. And in a way they can bring attention to things that staff see every day and don't notice, or are too busy, or it's somebody else's responsibility.
I think it's vital that healthcare staff start to see patients right at the heart of a safety culture, rather than us just being bystanders in that culture, which is what it feels like at the moment, that we have patient voices but they're not often heard as they should be.